Hello. Okay, let's go. Hello. Hello, hello, and good evening. This is our third take for this live. We are going to talk about mental health. My name is Doc Butch. I am a medical doctor and an entrepreneur, and this talk is sponsored by Doctors on Call Healthcare Redefined. Yes. Okay, so ano ba talaga itong mental health? And ano ang mga dapat nating malaman sa usaping mental health? Okay, so remember that there is no health without mental health. Okay? There is no health without mental health. Ibig sabihin po nun, just like your physical health, you need to pay attention to your mental health because in the past years, in the past decade or century, meron tayong stigmatization. And this stigmatization causes the hesitancy of the people to seek professional or medical care when it comes to their mental well-being. Okay, so let's define what is mental health. Mental health is an interplay of these three. It certainly talk about wellness. Wellness of your emotional state, wellness of your psychological state, and wellness of your social state. Ibig sabihin po nun, ng emotional wellness, you have the ability to feel it's okay not to be okay. You know? It's okay not to be okay sometimes. But what is not okay is if your reaction to a certain situation or stimulus is overwhelmingly abnormal, meaning you are stepping on others' rights or you are causing harm to yourself or to other people, that is no longer normal. It's okay to feel fear. It's okay to feel anxiety. It's okay to feel happy. It's okay to feel sad. These are emotions, and these emotions are real. As long as you are self-aware and you can handle your emotions, then that is emotional wellness. And that is one component of mental health. Yung isa naman po ay tayo bilang tao, we are social beings. We belong to the society. We need to belong to the society. We have friends, we have acquaintances, we have workmates. These are our social support. Now, no man is an island. No one can exist alone. If you have social isolation, then there is something wrong with your mental health. Now, despite of this pandemic na nagkaroon tayo ng mandate to have social isolation, social distancing, hindi naman tayo nagkakaroon ng social isolation because we have the technology to still interact with our social support. Hindi nga dapat social distancing ang ginagamit dyan. Dapat physical distancing. Okay. About psychological well-being or psychological wellness, dapat tama din ang iyong pag-iisip. Meaning, hindi ka nakakakita ng mga bagay na hindi nag-i-exist. Wala kang naririnig na boses kung walang nagsasalita. Meaning, your sensation and perception are reality-based. and your beliefs are grounded by reality and not the delusional type. So psychological, behavioral, emotional, social well-being are your components of mental health. Okay. The DSM-5 or the Diagnostic Statistical Manual 5 proposed definitions of mental disorders. Number one, it's a clinically significant behavioral or psychological syndrome or pattern that occurs within an individual. It occurs within an individual. It's happening inside you. You have the behavioral or psychological syndrome, meaning a combination of your behavioral or psychological changes. For instance, dati okay ang pag-iisip mo, you have a coherent mind, and then ngayon, hindi na okay. May mga hallucinations ka na or may mga delusions ka niya. Psychological syndrome na yon, no? Behavioral means we behave according to what we think and what we feel. Bakit? Nababasa mo ba ang pag-iisip ng ibang tao? Nararamdaman mo ba o nakikita mo ba kung ano yung feelings niya? Hindi. No? You can never read minds. You can never read thoughts of and feelings of the person. But what you can see, what you can read are their behaviors, because we behave according to what we think and what we feel. So if the person has a sudden change of behavior, you know and you should understand that there is something going on inside that brain. In the thoughts of the person or in the feelings, there's something going on. And it's always okay to ask and communicate. Effective communication skills can help you manage people, okay? And do not assume or do not stigmatize people undergoing these kinds of changes. Okay? The consequence of this behavioral psychological syndrome is distress, like painful symptom or disability or impairment in one or more important areas of functioning. Meaning, for example, dati okay ang kanyang pagtatrabaho, nagagawa niya yung activities of daily living, yun na yung kanyang routine, and then ngayon, hindi niya na kayang gawin yon dahil may impairment in cognitive o yung pag-iisip o disabled na siya because of the effects of the behavioral or psychological syndrome. Yan ay mental disorder already. And of course, it is not merely an expected response to a common stressor or losses. So for example, if you lose a loved one, there is expected grief, di ba? So there is a grieving process, no? Expected yan sa mga taong nagkaroon ng nawalan ng mahal sa buhay. So hindi mo matawag na mental disorder yan kung umiiyak siya or nalulungkot siya or nagkaroon siya ng traumatic experience, yung response niya sa trauma. It's because these are expected response to a stressor. Hindi mental disorder yon, but a normal grieving process. Okay? So move on pa tayo. Ayan, it reflects an underlying psychobiological dysfunction. Okay, so like I said, hindi na siya nakaka-function normally. Iba na siya, parang may off sa kanya. That's because of there is an undergoing problem in the mental well-being of the person. And it's not solely a result of social deviance or conflicts with society. May mga tao naman talagang difficult, no? May mga taong they commit crimes, they violate the rights because these are neurotic disorders. They have behavior disorders. They have personality disorders. Okay? So, hindi lamang siya attributed to that, but it's a syndrome, meaning a combination of behavioral or psychological syndromes. Okay? So, in the world, titingnan natin in 2018, about 970 million people worldwide have mental health or substance abuse disorder. Ito ang recorded lamang, reported, diagnosed. Now, my question to you guys, how about the undiagnosed? How about those people who have no access to professional help na hindi na-report ng ating statistics? See, I think it's a significant number out there. There are people out there that have no access to medical care or to psychiatric care, or there is no willingness because of napangunahan sila ng stigma. Kasi nga, pag nagpa-check up sa psychiatrist or psychologist, nasi-stigmatize ng society na, baliw na ito siya, ganito, ganyan, no? Kaya mali yan. Let us correct that. Let us stop the stigma. Mental health is as equal as your physical health. Now, anxiety is the most common mental illness in the world, affecting to about 284 million people. What is anxiety? Anxiety is a feeling of apprehension. Apprehension, meaning there is an uncomfortable feeling that is affecting your thinking and behavior. For example, it depends on the level of anxiety. We have the mild anxiety, we have the moderate anxiety, we have the severe anxiety, and we have the panic level of anxiety. Now, for example, binigyan kayo ng deadline sa work to submit, let's say, your financial papers. And the deadline is like within 3 days. So, nagkakaroon ka ng mild anxiety. Your mild anxiety actually pushes you to have a high alertness level and perform the job. It's actually therapeutic and sometimes helpful to you because with that pressure, you become productive. And example, exam mo na next week. Pero kung exam mo next year pa, parang walang pressure, so wala lang din tayong ginagawa. Kaya yung mild anxiety, medyo nakakatulong yan, actually. We have the moderate anxiety. Moderate anxiety, you have selective inattention. Medyo controlled mo pa yung pag-iisip mo, pero pinipili mo na lang yung iyong attention. No? We have severe anxiety, wherein there is a marked personality disintegration, and of course the panic anxiety, wherein there is already inability to respond to the stimulus because you are already panic stricken. Yung tinatawag nilang profound personality disorganization. Now that's where your coping mechanisms comes in. They protect the personality and prevent anxiety. Okay? Now, if your coping mechanism is inadequate, then you are not in a state of stress, but you are in a state of crisis. Globally, mental illness affects more females, around 11.9% versus yung males na nasa 9.3%. Yeah. Okay. Now, major depression, ano ba yung major depression? Yung persistent sad mood of more than 2 weeks. Anxiety, yes, na-discuss ko na. Alcohol use disorders, yung chronic alcoholism, yan yun, yung hindi na nabubuhay ng walang alcohol. Schizophrenia, meaning ng schizophrenia, ito ay psychotic disorder of more than 6 months, meaning ng psychosis, your reality is impaired. You see something that is non-existing. You feel something that nobody is touching you. You are hearing voices but nobody is there. Those are hallucinations. You believe in something that is, it's a fixed false belief. That's delusion. Yan yung mga psychotic symptoms of more than 6 months ay tinatawag nating schizophrenia. Bipolar disorders naman, yung may manic depressive episodes, may manic and hypomania episodes, cyclothymia, and yung mga bipolar disorders is a mood disorders, a pattern of yung wave-like changes ng kanyang mood. Dysthymia, ito ay mild depression pero prolonged, persistent mild depression. These were identified as the leading causes of disability, meaning sila yung mga nagko-cause ng physical and mental disability to our population. And the mortality rate naman of those with mental disorders is significantly higher than the general population with a median life expectancy loss of 10.1 years. So, if yung taong walang mental health problem, yung walang mental illness, ang average life expectancy is 70, yung may mental illness is minus 10.1 years, or around nasa 59 or 60 years ang kanilang life expectancy. Because once your mental health is affected, all else are also affected. It's important to take care of your mental illness. Of your mental health. Okay? So, you need to improve your mental health. I'm not going into details because our goal is to educate the public, and this is not a review for the board exam, which I am also a reviewer. Now, just remember that mental health is your responsibility. It's your responsibility. Why? Because you are the only ones who knows what your thoughts are and what your feelings are. Ikaw lang nakakaalam ng iniisip mo at ng nararamdaman mo. And if you feel and if you think that there is something wrong with you, please be responsible and seek professional help. Okay? So mental health is your responsibility. What you can do is to identify your stress and your stressors. Ano ba itong stress and stressors? Yung stress ay ang response mo, non-specific response mo to a stressor. A stressor is someone, a person, an event, a situation that may cause stress. And the stress is your non-specific response to a demand made upon you. For example, each of us respond to stress differently. Some of you respond to stress by, overeating. Yung iba naman, walang appetite. Yung iba, matulog. Yung iba, hindi nakakatulog. So, iba-iba ang response natin sa stress. And not all stress are bad. Yung bad stress, ang tawag doon, distress. Yung good stress naman, yung tawag natin doon ay eustress. But regardless of what kind of stress you are having, your body responds to it. So, identify. That's the most important thing. Self-awareness. Are you aware of your stressors? Are you aware of your stresses? Now, what do you do about it? Because hindi sa lahat ng oras you have to fight every battle. Hindi sa lahat ng oras you have to react in every stressor. Sometimes you can just ignore it, or sometimes there are things that needed your attention. So choose your battles wisely. And of course, your coping skills should be adequate. Coping skills are developed over time. It is inculcated in you the way you were brought up, or the kind of environment where you are in, or it's a learned behavior kasi, a learned behavior from previous experiences, how you were able to cope up with your stresses before. Sometimes it is still effective, but in the event that your coping skills are no longer adequate or no longer effective, you are no longer in the stress situation. You are in a chronic stress, or what we call is an acute crisis situation. And if you are in a crisis, meaning ng crisis, a sudden event in one's life where coping mechanisms are inadequate or inappropriate. Okay? So, when you are in a crisis intervention, you lose your normal functioning. You become, disabled or paralyzed by your stressor, by their stress, you need professional help. You need crisis intervention. The goal of crisis intervention is to put you back into the pre-crisis level of functioning. And with that, you need to seek professional help. Professional help po. Doctors, psychologists, psychiatrists, guidance counselors, allied medical professionals, nurses, yung nag-aral about that because there is a science behind it. There is always a science behind your symptom. For example, depression. Akala mo mood mo lang yan. Hindi. May science po behind that. Like your serotonin. Your serotonin is low in your synapses in depression. So we need to give you some drugs or medications that will inhibit the reuptake of serotonin at the neurosynapses, no? Yung SSRI ng mga gamot yung tinatawag natin. We have different types of antidepressants that will actually increase the presence of serotonin at the synapses, at the postsynaptic cleft. Masyadong science na yon para sa inyo. But the point is there is always a science behind it. Like your schizophrenia or your psychotic disorders. Okay? Some of them have persistent symptoms of delusions, hallucinations. So this might be caused by the dopamine in the brain. There is an increased dopamine in that area. So we can give dopaminergics or block the dopamine receptors. There are things that napag-aaralan ng ating mga experts. So, hindi lamang pharmacotherapy ang pwedeng gawin para maging okay ka. Meron tayong mga combinations ng ating behavioral, gestalt, cognitive therapy. Counseling is very, very effective. So, sino ba ang makakapagbigay niyan sa'yo? Siyempre, yung nag-aral niyan, yung professional help, yung licensed practitioner. Okay? So, do not just rely on your neighbor or your mga falsely advertised na mga claims ng mga herbal na yan na siya yung nakakapaggamot ng mga karamdaman natin. Always seek professional help because there is a science behind it and we studied that and we have evidence-based practice that can help you in your mental health problem. Okay? So, remember that there is no health without mental health. And mental health is your responsibility. Okay? Maraming salamat po. I hope meron kayong natutunan sa ating session ngayong gabi. Kahit na this is my third take, hindi na ito live. Feel free to follow me on YouTube for more lectures like this. And of course, this lecture is brought to you by your Doctors on Call Healthcare Redefined. Good night and good evening.